Good morning, everybody. Scott Maybor here with your Medicare Missive from the pond for Monday, the 7th of July. I hope you all had a wonderful holiday weekend. Today, I wanted to talk about those over 65 still working and maybe covered on the group plan and maybe shouldn't be. So there are two ways to look at it. One side from the employee, what's best for them, and the other side from the employer and their group benefits broker. So the person who sells the health insurance to the company. So on Wednesday, I was at a group, longtime client. I work with them whenever people are eligible for Medicare and still on the group plan. It is a smallish employer. They're about 50 or so. And I met with 3 employees. One of them already has Medicare. He signed up for both A and B, but he's still on the group plan. So he's paying $185 a month for his Part B, plus he's paying whatever they charge for the group plan. Additionally, let's just stick with the employer point of view. So does that make sense? No, their group plan is kind of terrible, and they have a special group plan for people over 65, which is really terrible. And he could be on Medicare. So that was a simple fix. We just signed him up. He already had his A and B, and he will cancel the group plan. I informed the HR person, and he's now on Medicare as of July 1st. So that was nice and easy. July 1st? August 1st. The other 2 need to activate their Part B. One of them has A. Well, actually, they both have A. We need to activate their Part B. They're going to do that this week. Ideally, we'll get them on the Medicare plan for August 1st. They will be off the group plan. From the group's perspective, and there's another employee I just actually got an email from. His HR person emailed me on Thursday, whatever day the holiday was. I'm sorry, I messed up. Emailed me and said he's got his A and B card. He's got his Medicare card. Now what do we do? Same situation. He's 67 years old. It's a small company. He needs to be off the group plan and be on Medicare. From the employer's point of view, as well as the group broker's point of view, does it make sense getting people who are over 65 off the plan? Absolutely. I mean, in all likelihood, Medicare is going to be better for them, but also better for you. So how is it better for the company? If you have a smallish company and you have a handful, 10%, 5% of the employees are over 65 and qualify for Medicare, they are raising the price for everybody else. So they're raising their own price, they're raising the price for the group, and they're raising the price for the employer. So everybody's paying more because they're bringing up the average age. From a group benefit perspective, as a broker, wouldn't it be nice to say, hey, listen, we can bring somebody like Scott in, have him explain Medicare to the people, show them what it would actually cost. In one case, that company I just mentioned, one of the previous people I worked with, we saved him $300 a month on his medications because they were so much cheaper on Medicare than they were on the group plan. $300 a month, plus he was paying for both also. There are some language challenges there, so people sign up and then stay on the group plan. So, I mean, you're talking with the cost of the group insurance plus his drugs, $400-500 a month unnecessarily. The woman who emailed me on Thursday, I will speak to her employee. He's got his A and B card, and we'll do that. So for the group benefits brokers, we have a conversation with the employees who are eligible. They have an open enrollment anytime to switch. Come renewal time, you've dropped your average age. The census has an average age that's lower. And again, this is not something to force upon the employees. And if you're over 20 employees, they're entitled to be on the group plan, but it may not be in their best interest. Just because they have an entitlement doesn't mean they should exercise it. And it is better for everyone in many cases if they don't. If the employer is less than 20, they absolutely need to be on Medicare, period. Medicare is the primary carrier. And I told somebody that. I mentioned it in a previous video. He didn't believe me. I said, call your broker and confirm that you are fully covered without having Part B active. And he did, and he texted me the other day and said, you made me feel old, but now I'm fully on Medicare. Um, you know, it's if you can save money, the company can save money, all of the other remaining employees save money. Medicare is definitely something groups need to consider. There are group Medicare options that they could allow, that you could implement, which we're happy to discuss, where you take a group program, offer it to anybody who works for the company or their spouses, which is more incentive for them to get off the group plan because of that hesitation that, oh, I'm kind of out on my own now if I'm on Medicare. I like the security of the group. Great, offer a group Medicare plan. Doesn't cost you anything. It's voluntary unless you choose it not to be and you want to kick in something. Let me know if you have any questions, thoughts. The only caveat would be if somebody's high income, Medicare is income adjusted. So if somebody's high income, you have to weigh that into the mix too and see, does Medicare make sense from a cost perspective? If the group is over 20 and there's a high income surcharge applying, the group may be cheaper. But it's more than just premiums also. You also have to look at the co-pays, you have to look at the deductible, you have to look at the drug coverage. So it is a conversation, it's worth considering. We can always have that talk and see, does it make sense to see if both those employees or not, and go from there. Have a great day, everyone. Thanks for watching. Be well.